When prescribed by your physician, a conservative, non-invasive arthritis management program will consist of exercises, joint protection, and therapeutic modalities. A therapist through an evaluation process will determine a set of proper exercises and show you correct techniques with timing and duration. Home exercises will be provided. During evaluation, an assessment of aids and equipment will be considered. To help alleviate pain or reduce stress on joints, a splint will be recommended and a custom splint fabricated. In addition, modalities such as heat, ice, ultrasound, TENS and laser will be incorporated in a customized therapy program. As we discussed earlier, each joint is naturally allowed a unique range of motion. Initial set of exercises are chosen from a wide variety of exercise equipment. The therapist first achieves stretching through gentle manual manipulation in one-on-one sessions. Through various measurements, the therapist is able to record improvements. Very gradually, joint strength is improved. A singular focus on a joint or a group of joints and very gradual increases in resistance leads to pain reduction over time. A home exercise program is designed from over 1,000 exercises. With easy-to-follow illustrations, your therapist will recommend hold, repeat, and session times for each exercise. We have chosen one illustration each for elbow, finger, hand, and shoulder. You may receive instructions for several exercises. In conclusion, let us review some general guidelines. When doing any activity or activities around the house such as cleaning, yard cleaning, or playing a game, do not do it for longer than 2 hours. Mix and match activities and rotate them if you can so that you are exerting different part of your body, muscles or joint. Do not exercise a joint or put strain on an affected body part that is swollen, red, or tender to touch. This is especially important for something you love to do often such as cooking or playing tennis. Make sure that if you have an exercise program, it directly addresses your particular problem and needs. For arthritis sufferers, most important advice is for you to learn to be experts in body mechanics. In the beginning, we spent quite a bit of time on this. Body mechanics helps you to see why you may not use muscles in one position for a long period of time and should use the strongest joints available for an activity. For example, not to use the right hand if the wrist hurts the most when cooking, and not to use the right thumb to hold your tennis racket if you have arthritis in thumb. Avoid a tight grip to open a jar, instead use an aid. Avoid ulnar deviating pressure on fingers and lateral pressure on individual fingers. Aids. There are inexpensive mechanical aids are commercially available for you to use. These aids provide mechanical advantage and reduce the effort you have to use to perform a task. Splints. Under certain conditions, you may need splints to support your joints. These may be off the shelf or have to be custom fitted. Make sure to see your physician for a recommendation and your therapist for measurement and fitting. You hear a lot about remedies or instant cures. Just be aware of unproven remedies. Check them out through support groups or arthritis organizations. Finally, let us take a few minutes and take a clinic arthritis quiz. I will show you the 10 questions one by one, and then you can answer them as true or false on the notepad. When you are done, I will give you the Mayo Clinic answers. We want to thank you for visiting, and I hope this presentation was useful. I will leave you with a list of arthritis organizations. Thank you.